Senate should note that Nigeria continues to record increasing cases of medical emergency, including snakebite, scorpion, sting poison, drug overdose, and other form of envenomation, all of which require the immediate administration of specific antidotes and emergency medicines in both public and private school hospitals in order to prevent avoidable death and irreversible health complications. Further note that with grave concern, the tragic and avoidable death of Mrs. Ifunanya Nwangene, who reportedly died following a snake bite in Abuja recently, thereby revealing serious gaps in emergency preparedness and antidote availability within public and private hospitals in Nigeria. Aware that the World Health Organization classifies snake bite envenoming as a neglected tropical disease and underscore the critical importance of timely access to safe and effective antivenoms in public and private hospitals, particularly in countries such as Nigeria, where snake bite incidents remain prevalent. Further aware that Section 17(3) of the Constitution of the Federal Republic of Nigeria, 1999 as amended, mandate the state to ensure the provision of suitable and adequate medical and health facilities for all persons, while Section 14, subsection 2b, affirm that the security and welfare of the people shall be the primary purpose of government obligations, which necessarily extend to regulations, supervision, and standard setting for public and private hospitals. Concern that a significant number of public-private hospitals across Nigeria do not stock essential life-saving antidotes such as antivenoms and antitoxins, or maintain insufficient quantities, leading to dangerous delay in treatment, unnecessary referral, and preventable loss of lives. Further concerned that victims of snake bites and other poison emergencies are frequently compelled to move from one public hospital to a private hospital or vice versa in search of antidotes during the critical golden hour, thereby substantially increasing mortality and morbidity rates. Distinguished ladies and distinguished colleagues, accordingly, the Senate resolved to urge the federal government, Federal Ministry of Health and Social Welfare, through relevant agencies and regulatory bodies, to develop and enforce national guidelines prescribing minimum stock level of essential antidotes and emergency medicines in designated public and private hospitals across Nigeria. Direct the Federal Ministry of Health, in collaboration with the National Agency of Food and Drug Administration and Control, NAFDAC, to ensure procurement, quality assurance, proper storage, and nationwide availability of safe, effective, and affordable antivenoms and critical antidotes for use in public and private hospitals, with priority attention to high-risk regions. Call on state government through their Ministry of Health and Hospital Management Boards to conduct immediate audit of public and private hospitals within their jurisdiction to ascertain compliance with approved antidote stocking and emergency preparedness standards, and to create awareness of such. Mandates relevant professional and regulatory bodies to strengthen emergency response standards and require periodic training on the administration of antidotes for healthcare personnel working in public and private hospitals. All the Federal Capital Territory Administration, FCT, and all state governments to establish coordinated emergency referral and response system linking public and private hospitals to ensure timely access to life-saving medicines during emergencies. Call on health regulatory authorities to make the stocking of essential antidotes a mandatory condition for the licensing, registration, and renewal of accreditation of private hospitals, while ensuring adequate budgetary provisions and supply mechanism for public hospitals. direct the Federal Ministry of Information and National Orientation Agency, NOA, to implement nationwide public sensitization campaign on the importance of prompt hospital presentation following snake bites, other poisoning and envenomation, and the dangers associated with delayed medical treatment. Lastly, direct the Federal Ministry of Housing and Urban Development to strengthen building regulations under the National Building Code by making non-return valves, NRVs, mandatory in construction to allow waste to exit while blocking rodents and snakes from entering buildings via drainage system. Mr. President, distinguished colleague, I so submit.
My colleagues, my name is Karime Sunday Steve. I represent the people of Kogi West. First of all, I want to thank my colleague, Senator Adebile, for bringing this important motion this morning. In fact, the death of that lady was a needless death. She had an unfortunate snake bite, and she took immediate precaution by at least isolating the blood flow just within limited area where she had the snake bite. She went to the first hospital very close by. Unfortunately, they added the antidote, and she was immediately taken to Federal Medical Center, Jabi. Within 1-2 hours of the snake bite, she was in the right place. But despite this, the lady who was communicating with everyone, telling even her loved one that she'll be okay, she lost her life. That shouldn't happen in our country today, because we are supposed to have antidotes to take care of such situation. So while we are condoling the family of the late woman, we have to be proactive as a government. I see no reason why most of our medical centers and hospitals all over the place shouldn't have medication for snake bites. We have to look at prayers that has been brought along with this motion and make sure that we take action to prevent future occurrence. Thank you.
Call attention for the provision of adequate medicine for the treatment of snake bites and such other health challenges. Mr. President, for some of us who are from farming communities who are easily exposed to snake bites, I found this motion very, very important, because many a times victims of a snake bite have to move all the ways from the villages to the state capital before they are able to access treatment. If these drugs are made available to our health centers across the length and breadth of the Federation, such needless journeys seeking medical attention at state capitals wouldn't be necessary. And I think government has it as a duty to provide health care to all citizens across board. So I think this motion is apt, it is necessary, and it speaks to the need for government to provide adequate health care for the citizens of this country. So I support the motion wholeheartedly. Thank you very much.
This motion, persuaded as it were by the bigger lessons. The bigger lesson that underpins the spirit in this motion is that we have to put in place policies about our healthcare system and then drive those policies. We don't have to wait until there's a fatality through snake bites. This is a lesson for us to be proactive, that we must take healthcare very serious. It is tragic that the deceased went the way she died, but the bigger lesson for us is a need for us to have in place policies that must drive our healthcare. The fatalities that are caused by snake bites can be very painful and indeed avoidable. One remembers in my earlier years a play that I read titled "This Is Our Chance" by James N. Henshaw, where there was a case made for preventive measures on snake bites. But beyond that, beyond our lamentation today, is that challenge that we must put in place policies that work. We must put in place measures that must drive our policies. And we must not wait until there's a fatality before we come out to learn lessons. We must, as a people, as a country, take our healthcare system very, very serious. We must protect the health of our people. My heart bleeds for the family of the deceased who could have done well for this country. It is one loss too many, but this is avoidable. This is avoidable through our greater attention to healthcare system in Nigeria. That we must put in place measures that underpin our challenges. That we must put in measures that look beyond today. We mustn't wait until there's a fatality before we rise up as a country. Health is wealth. Health is our major protection. So I aligned with the bigger lesson in this motion, and that lesson is that we must put in place measures that must protect us as a people. Thank you.
Distinguished colleagues, my name is Senator Professor Anthony Ani. I represent Ebonyi South. I very much align myself to the contents, the objectives and focus of this motion. I'm speaking based on personal experience I had some years ago of both snake bite and scorpion sting. I think what is needed most at this point is raising the consciousness and creating awareness of these ugly incidents that happen mostly in our rural areas. The prayers of this motion, two of them are very paramount, and I think we have to dwell us mainly on those two prayers, which are prayers 3 and 4. Prayer 3 says, call on state governments through the Ministries of Health and Hospital Management Boards to conduct immediate audits of public and private hospitals within their jurisdictions to ascertain compliance with approved antidote stocking. This is very, very important. Emergency preparedness. Many of these hospitals are not prepared. When this type of emergency arises, they begin to run helter-skelter, seeking for solution. There is no way to be found. And prayer 4 says, mandate relevant professional and regulatory bodies to strengthen emergency response standards. And this requires periodic training on the administration of antidotes. A situation where the antidotes are available, but people who are specialized in administering it are not there, it becomes a problem. In totality, Mr. President, my colleagues, I wholeheartedly support this motion. I so submit, Mr. President.
the Students College. Let me, on our behalf.